Dr. Theresa Tam said that from a federal perspective, they want as many Canadians as possible to be using the COVID Alert app. There could be interprovincial travel, and having people Canada-wide on this same app would be helpful. Now, Quebec's the second largest province. Isn't this a bit putting a bâton dans les roues of what the efforts of Ottawa is here by not signing on to this app?
Well, sorry? Wait? Okay. Well, thanks for the question. I think we didn't say no. I think we said we don't need it right now. Remember that we have consulted our population in the last few weeks, and there was some nervousness, and I think Mr. Kerr has explained clearly that there is a consensus now we sense from the population that under certain conditions they are willing to consider it. So there is an opening on the population. But again, at this level where we are in the wave, we think that we need the time just to make sure that we get ready if we need it. But we said clearly that we are open for it. So I think that's the combination that I would mention.
Just talking about this tracing app, yesterday Mylène Drouin was talking about some of the difficulties in Montreal with contact tracing. So we had these salsa dancing groups, they're outdoor events, they're not required to register names. And that's very helpful, she says, in doing this kind of contact tracing, and some people don't actually want to participate in giving out names. So are there other measures, if you're not going to go with, at this time, with a contact tracing app, and we're trying to prevent, as you say, a bushfire becoming a forest fire, is there something else we can be doing in order to make contact tracing, especially in Montreal, more effective?
Well, as I mentioned earlier, this is the reason we added about 1,000 people in public health. Because I think right now the issue is, as you know, it's testing, but it's making sure when we test that we can react quickly to that. And remember, I said there were 3 parts of that process, and the latter part of it, when we need to inform people, we need to inform them properly and quickly. So whatever you have a digital app or you do those contacts manually, you need somebody to talk to them and make the call that they have been contaminated, and we need to inform them. So right now, we think that under the circumstances where we are right now, we are able to contain that fire. But and this is the reason when we said that we asked Mr. Kerr to make sure that he's ready, because if it goes that our current group of people, including the one we had, if that's not enough, we want to make sure that this is complementary to the tools that we have. But I would say the first step was to make sure that we had those experts, those specialists that can, analyze those results and communicate with the people on the traceability.
And if I may add, it's not meaning that we will never use it. First of all, I think we're going to be ready if we need it. But I'll just tell you that actually, like some stories that we had in Costco in Quebec, or in the dancing situation in Salsa, the director of public health have been notifying the people that can recognize that they have been perhaps exposed and tell them to go. If an application is not well used by everybody, only 40% of the people will be notified, compared to a type of action we're doing now that we can do right now because the numbers are low. If it goes higher, and if we cannot anymore, I would say with our systems, get enough information to contact tracing, this could be something that is going to be added. And I think also the issue of the acceptability by the population is very important. So if we work that acceptability, I'm sure if we had implemented it, asked the questions, I would say earlier, less people would be, because people were afraid of confidentiality. So we must reassure, go by step, and when we're going to use it, we're going to be probably in a moment where, because of the cases going around, people will adopt that, and then it's going to be a tool that will get the impact that is needed, because you need at least 60–80% of the population having it.
Just to complete, because I appreciate the question. I think what we've seen, especially in the last month or the last 2 months, we've seen the contagion being in the medical sector with the CHSLD. So the tracing was one issue. Now that we're moving to communal contagious, so what we see with the dance this week, what we've seen in the Costco in Quebec City, when you enlarge the group, that's something that is a bit new for us compared to those small bushfire that were, because the typical case that we had in the last few months, apart from those, are contagious in manufacturing where 5 employees are being infected, or what we see, for example, in a restaurant, it's a limited number. So I think we're discussing and seeing how this evolved. The fact that now we have deconfined almost everybody, does the tools that we need are sufficient? That's the question we're asking right now. And I think that's the reason we're getting ready if we have more of those. So it's a balance, but we are getting ready to make sure we have it.